Hi, my name's Sarah. I am a doctor working on a COVID positive ITU ward. I actually contracted coronavirus myself a few weeks ago and have been asked by BPF to share my experience. My symptoms started with a sore throat and a mild cough. I then developed severe diarrhea, muscular aches and pains, a headache, and fatigue. I then had a high grade fever for 2 days. On the fifth day, my muscular aches and pains started to regress in severity, so I started moving around more, which was when I noticed that I was actually quite short of breath on movement. On the seventh day, I lost my sense of smell, I had a reduced appetite, but by the 10th day, most of my symptoms had resolved. The fatigue lasted the longest. I was sleeping for around 15 hours a day, and I had a total of 2 weeks off work. Things that I did to help manage my symptoms at home included keeping hydrated. So, particularly when I had diarrhea, I would mix water, sugar, and salt together to help replenish the electrolytes that I was losing. I also took paracetamol regularly, not only to help with the aches and pains, but also to help keep my fever down. On the occasions where my fever wasn't controlled with paracetamol, I would have a cold shower or sit by an open window to try and cool my body temperature. Um, in terms of the psychological impact of having coronavirus, I would say, even as a doctor, I found it difficult to distinguish whether my shortness of breath was due to anxiety or a genuine symptom. So I bought a pulse oximetry from Amazon, but I think they're also available in Argos, and it tells you your oxygen saturation or the level of oxygen in your blood, as well as your heart rate. So that helped to reassure me. Equally, there is something that you can do called the Roth scale, where you count from 1 to 30 in your native language as quickly as you can. If you become short of breath prior to reaching the number 30 or within 7 seconds of starting, then that could be an indication that the oxygen levels in your blood are low and you should seek medical attention. In terms of working in ITU in a COVID positive ward, I have noticed a trend that patients who are overweight with diabetes and hypertension tend to be the demographic of patients that are getting admitted to ITU. And actually, for majority of patients, these three things are reversible with regular exercise and a good diet. So that's something to think about, but also reinforces that we should be isolating ourselves. I hope that you found this useful. Thank you for listening.